Refer to your medical record for the IV therapy order. Perform your initial steps, including hand hygiene and identifying your patient and verifying allergies. Supplies that you need will be an IV Cathlon, at least 2 normal saline flushes, IV start kit, normal saline lock, extra drape, and additional extra supplies as needed. Begin by opening your IV start kit. Place the fluid barrier under the intended site for insertion. Remove and prepare your tape strips. Prepare your tegaderm nearby for access and apply a tourniquet to. Find your intended IV site and always make sure to release your tourniquet. Don clean gloves and prepare to clean the site. Clean the site for 15 to 30 seconds and allow it to completely dry via air dry. Prepare your normal saline lock by opening it in a sterile fashion and opening one of your 10 milliliter saline flushes. Connect it aseptically to the clave end of the normal saline lock and prime accordingly. Loosen the cap to the connector piece and place it nearby the intended IV site. Open your IV Cathlon You may now reapply the tourniquet. Using caution not to retouch your cleansed IV site, check the radial pulse. Remove the cap to your Cathlon in one swift outward motion and inspect it for defects. Do not lift the Cathlon up over the needle. Hold the skin taut with your non-dominant thumb and insert the needle bevel up in the skin. When you see blood return, advance the needle just a fraction farther. Then you may advance the Cathlon over the needle until you get to the hub. Place firm pressure over where you anticipate the end of the Cathlon is inside the vein and retract the needle via the safety button. Quickly but gently, while securing your site, remove the cap from the saline lock and attach it to the Cathlon. Pull back on the plunger of your saline syringe to be sure that you still have blood return, and then flush gently according to facility policy. Cover the site with a tegaderm, being sure to only cover the Cathlon. Be sure to label your site with your initials, the date, and the time, as well as the gauge of the needle. If there is any residual blood in your saline lock, be sure to cleanse the clave and flush appropriately. If connecting to a primary line, you may do so now. If not, loop the saline lock around to be sure that it does not kink on its own and tape appropriately. Remove your gloves and clean up your work area. Be sure to document the procedure, as well as how the patient tolerated it, and any medications that you give through the IV site.